Bismillahirrahmanirrahim. We shall explain you today the nutritional importance of dietary lipids and the incidence of atherosclerosis. In this regards, the objectives of today's lecture are to explain you the classification of lipids according to their nutritional examples and to explain you the sources and the recommended dietary allowances of the dietary lipids and to explain you the functions of the dietary lipids and fatty acids and to explain you the biochemical mechanism for the developing of atherosclerosis. And in the end, we shall explain you the clinical significance of dietary lipids with reference to metabolic syndrome and the atherosclerosis. In this regards, the purpose of this lecture is to explain you that the incidence of number of chronic disease are significantly influenced by the kind and the amount of nutrient consumed. Incidence of number of chronic diseases is influenced by kind of the diet taken, nutrient taken, and the amount of nutrient consumed. In this context, the role of dietary fats and the incidence of coronary heart disease is thoroughly documented, which we have to explain you. In this regards, the dietary recommendations in the past emphasized on decreasing the intake. They emphasize on decreasing the intake of the total amount of fat and cholesterol in the diet. It was said that excess intake of fat in diet causes elevation of serum total lipids, causes increase in the triglyceride, causes increase in the blood cholesterol level, thus increase the risk of heart disease, increases the risk of stroke, obesity, and the diabetes mellitus. Recent studies suggest that high intake of fat in the diet is also associated with increased risk of breast cancer, colon cancer, and the prostate cancer. However, researchers now indicate that the type of fat taken in the diet. Nowadays, researchers indicate that the kind of fat taken in that kind of fat taken in the diet is more important to consider for these conditions than the amount of fat consumed. And in some animal studies, it is observed that polyunsaturated fatty acids of omega-6 class are more tumorigenic than other unsaturated fatty acids. Reason is not known, but it is suggested that the prostaglandins, which are derived from omega-6 fatty acid, stimulate the tumor progression. Prostaglandins, they are derived from arachidonic acid. Arachidonic acid is 20 carbon containing polyunsaturated fatty acid. Arachidonic acid is also derived from linoleic acid. Linoleic acid is parental fatty acid of omega-6 family. And the arachidonic acid which is derived from the linoleic acid is precursor of prostaglandins, and it is suggested that the prostaglandins derived from omega-6 fatty acids stimulate the tumor progression. And it is also seen that increased consumption of polyunsaturated fatty acids has hazardous effects due to production of free radicals, due to production of toxic oxide. Therefore, polyunsaturated fatty acids may be injurious to the body, to the cell, unless antioxidants are available. Similarly, saturated fatty acids. If saturated fatty acids, when they are consumed in excess, they inhibit receptor-mediated uptake of LDL. Thus, they cause increase in the LDL cholesterol, which is bad cholesterol, and increase the incidence of coronary heart disease. Therefore, it is advised, which we have to understand. Therefore, it is advised to consume proper proportion of fat containing saturated fatty acids, monounsaturated fatty acids, and the polyunsaturated fatty acids. So the central idea of today's lecture is to understand the proper proportion of fat containing saturated, monounsaturated fatty acid, and polyunsaturated fatty acids of omega 3 and omega 6 family in the diet. In this regards, to understand different type of fatty acids present in the dietary sources, different type of fatty acids present in the animal fat, different type of fatty acids present in the plant sources, it is important to take an overview of the classification of fatty acids. In this regards, the fatty acids, they are classified in two main classes. One is the saturated fatty acids and other is the unsaturated fatty acids. Apart from saturated and unsaturated fatty acids, there are many other type of fatty acids. Some fatty acids, they are hydroxyl group containing fatty acids. Some fatty acids, they are methylated fatty acids. Some fatty acids, they are branching fatty acids. Some fatty acids are odd chain containing fatty acid. So there is large variety of fatty acids. But as here in today's lecture, we are concerned with the dietary lipids. In this regard, the two important classes of fatty acid is one saturated and other is unsaturated fatty acids. So what are saturated fatty acids? Saturated fatty acids are those fatty acids in which valency of each carbon is fully satisfied. It means there is no double bond present in these fatty acids. So what are saturated fatty acids? Are those fatty acids which do not contain any double bond in their structure. And unsaturated fatty acids contain double bond in their structure. So saturated fatty acids are usually solids at room temperature. If we see the examples of saturated fats such as ghee, butter, margarine, they are solids at room temperature because they are rich in saturated fatty acids. There is wide variety of saturated fatty acids which vary from each other in number of carbons. They contain from 4 carbon to 24 carbon. Many fatty acids containing more than 20 carbons are also present in our body. And in this regard, it is noted that as the chain length of the carbons in the saturated fatty acids increase, there is increase in the melting temperature of the fatty acid. Some of the important examples of the saturated fatty acids are butyric acid. Butyric acid is 4 carbon containing fatty acid. Butyric acid, caproic acid, caprylic acid, capric acid, lyric acid. Lyric acid is 12 carbon containing fatty acids. Myristic acid is 14 carbon containing saturated fatty acids. Palmitic acid is 16 carbon containing saturated fatty acid. Stearic acid is 18 carbon containing saturated fatty acids. So there is big list of saturated fatty acids present in our body. And it is observed that the melting point of these saturated fatty acids increase with increase in number of carbons. For example, if we see the melting temperature of butyric acid is 4 carbon containing saturated fatty acid and its melting temperature is only 8 degrees centigrade. But if we see the melting temperature of palmitic acid, which is 16 carbon containing saturated fatty acid, its melting temperature is 62 degrees centigrade. Butyric acid 4 carbon, melting temperature is only 8 degrees. But palmitic acid 16 carbon, melting temperature is 62 degrees. if we see the melting temperature of the stearic acid, it is 70 degrees. So it is said that increased consumption of saturated fatty acids inhibit receptor-mediated uptake of LDL. Thus, increase in LDL increases the incidence of coronary heart disease. The foods which are rich in saturated fats contains both. The foods which are rich in saturated fatty acid contains these two fatty acids. One, myristic acid, which is 14 carbon, and other palmitic acid, which is 16 carbon. Especially these two saturated fatty acids, they are more atherogenic. That is, they may cause narrowing of blood vessels. They may be responsible for the formation of atherosclerotic plaque. When blood vessels are narrowed, blood passage is disturbed and less blood flow and causes the ischemia and other cardiac problems. While stearic acid is 18 carbon containing saturated fatty acid, but it is not atherogenic like myristic and palmitic acid and has little effect on the blood cholesterol. Then the second group of the fatty acid is the unsaturated fatty acid. Unsaturated fatty acids are those fatty acids which contain double bond in their structure, and they are divided as monounsaturated fatty acids and polyunsaturated fatty acids. Monounsaturated fatty acids are those which contain one double bond. The very most important example of the monounsaturated fatty acid is oleic acid. And oleic acid is example of omega-9 fatty acid. What is omega-9 fatty acids? What are omega-6 fatty acids? Or what is omega-3 fatty acid? We will explain you later on. So oleic acid is monounsaturated fatty acid, contains one double bond. Then second group is the polyunsaturated fatty acids. Polyunsaturated fatty acids are those which contains two or more than two double bonds. The most important example of polyunsaturated fatty acid, it is linoleic acid. Linoleic acid, it is a 18 carbon containing polyunsaturated fatty acid which contains two double bonds. And this is classified as omega-6 fatty acid. And linoleic acid can give rise to formation of arachidonic acid. Arachidonic acid is 20 carbon containing polyunsaturated fatty acid, and it is derived from the linoleic acid. Therefore, it is also classified as omega-6 fatty acid. And the other important example of polyunsaturated fatty acid is linolenic acid. Linolenic acid, it is 18 carbon containing polyunsaturated fatty acid with three double bonds. And linolenic acid can give rise to other polyunsaturated fatty acid like EPA, eicosapentaenoic acid, 20 carbon containing polyunsaturated fatty acid with five double bonds. Or linolenic acid can give rise to another polyunsaturated fatty acid, that is docosahexaenoic acid, which is 22 carbon containing polyunsaturated fatty acid. As these two fatty acids, eicosapentaenoic acid and docosahexaenoic acid, they are both derived from linolenic acid. So they have also the same omega value, that is, they are also classified as omega-3 fatty acids. So now, what is omega-3, omega-9 or omega-6 fatty acids? So you can see, if you see here in this picture, this is oleic acid. It is classified as omega-9. Linoleic acid, it is classified as omega-6. Linolenic acid, it is classified as omega-3 fatty acid. So actually, the what is omega? the carbon atoms of the fatty acid can be numbered in two ways. Carbons of the fatty acid, they can be numbered from carboxylic carbon. If we take carboxylic carbon as number 1 carbon, this is called delta numbering. Carboxylic carbon is considered as delta 1. But if we count the carbons of the fatty acids from methyl end of the fatty acids, it is called omega N. So methyl carbon is omega 1, next is omega 2 and omega 3. Now what we mean by omega 9? Omega 9 fatty acid is that fatty acid which has first double bond present at carbon number 9. So if you see the structure of oleic acid, it has first double bond present at carbon at omega 9 carbon. Therefore, this is classified as omega 9 fatty acid. Linoleic acid, which is 18 carbon containing fatty acid, it has first double bond present at carbon at omega 6 carbon. Therefore, linoleic acid is called omega 6 fatty acid. Similarly, linolenic acid, it has first double bond present from the methyl end at omega carbon 3. Therefore, this is classified as omega 3 fatty acid. Now, particularly talking about the linoleic acid and linolenic acid, these are parental fatty acids of omega 6 and omega 3 class. These both fatty acids, they are essential fatty acids. They are not synthesized in our body. Our body has ability to synthesize different type of fatty acid. In our body, there are enzymes which are referred as elongase, which can increase the carbon chain of the fatty acid. Or there are enzymes unsaturases which are present in our body which can form unsaturated fatty acids also. But our body has not ability to synthesize linoleic acid, particularly linoleic acid and linolenic acid. Therefore, linoleic acid is called parental fatty acid of omega 6 family, and linolenic acid is said as parental fatty acid of omega 3 family. But this omega 6 fatty acid can give rise to other polyunsaturated fatty acid, but its omega value will be same. As we told you previously, arachidonic acid is 20 carbon containing polyunsaturated fatty acid. But as it is derived from linoleic acid, so arachidonic acid has also first double bond present at carbon number 6 from the methyl end. It is also classified as arachidonic acid is also classified as omega 6 fatty acid. Or linolenic acid, which is parental fatty acid of omega 3 family, can give rise to eicosapentaenoic acid and docosahexaenoic acids. Both fatty acids, because they are derived from linolenic acid. So if you see their structure, they also have their first double bond at carbon number 3 from methyl end. So they are also omega 3 fatty acids. And other important point which we should know, in the saturated fatty acids, we told you that as the chain length of the saturated fatty acid increases, their melting temperature increases. But in case of unsaturated fatty acids, as number of double bond increases, the melting temperature of these fatty acid decreases. For example, if you see the melting temperature of the oleic acid, which contains one double bond, melting temperature is 14 degrees centigrade. But if we see the melting temperature of linoleic acid, which contains two double bonds, it decreases to -5 degrees. If we see the melting temperature of linolenic acid, which contains three double bonds, it decreases to -10 degrees. If you see the melting temperature of the arachidonic acid, which contains 4 double bond, it is about minus 50 degrees. So as the degree of unsaturation increases, the melting point of the polyunsaturated fatty acid decreases. And in the saturated fatty acid, as the melting point, as the number of carbons increases, melting point of the saturated fatty acid increases. Then coming to composition of the dietary lipids. Dietary lipids, they are widely available to us from animal sources as well as from the plant sources. Fats derived from animal sources are rich in saturated fatty acids, while fatty acids derived from plant sources are generally rich in unsaturated fatty acids. But this is not an absolute rule, since coconut oil, it is made up of mostly 12 and 14 carbon containing saturated fatty acid. Only 5% monounsaturated fatty acid and only 1% polyunsaturated fatty acids are present. But in general, animal fats has 40 to 60% saturated fatty acid and 30 to 50% monounsaturated fatty acids and very little amount of polyunsaturated fatty acid. By contrast, plant oils contain 10 to 20% saturated fatty acids and 80 to 9% unsaturated fatty acids. As current recommendations direct us to obtain maximum 30% of the energy intake is fat, 10% each from saturated fatty acids, monounsaturated and polyunsaturated fatty acid. Therefore, it is very important to take controlled dietary intake of fat. Therefore, we divide dietary fats in two groups as visible fats and invisible fats, because it is recommended that the maximum energy intake from fat should be 30%. Therefore, it is important to take limited amount of the fat in the diet. Therefore, dietary fats which are consumed by us are divided in two groups. One is visible fats and other is invisible fat. Visible fats are the oils or butter or ghee which is used by us in cooking process. While invisible fat is also available to us from food items like fish, meat, cereals, and oily seeds. This fat is not visible, but it is contained in food items which are available to us when we utilize them. Therefore, it is recommended that daily intake of visible fat should not exceed more than 20 grams. It is recommended that visible fat, that is cooking oils which are used by us, it should not increase more than 20 grams per day. Or we should take 10% of total calories intake from the visible fat and rest from the invisible fats. Then this picture explains us the fat contents of some food. You see, this picture explains us about the types of the different fatty acids, that is presence of saturated fatty acids, monounsaturated fatty acids, and polyunsaturated fatty acids of omega-3 and omega-6, which are confirmed in different food items which are utilized by us. Like you see here, safflower oil contains only 0.8 gram% of the saturated fatty acid, while safflower oil contains 10.2 gram% of the monounsaturated fatty acid. and 2 gram percent of the polyunsaturated fatty acid of omega-6 family. Omega-6, omega-3 polyunsaturated fatty acids are absent in safflower. If you see the fatty acid composition of the canola oil, which is very commonly used, canola oil and sunflower oil, they are very commonly used by us. Canola oil contains only 1 gram percent of the saturated fatty acid, but canola oil contains 8.2 grams of monounsaturated fatty acid and 2.8 grams of polyunsaturated fatty acid of omega-6 class and 1.3% polyunsaturated fatty acid of omega-3 class. And if you see the fatty acid composition of sunflower oil contains only 1.4 gram percent of saturated fatty acid, but it contains 2.7% of monounsaturated fatty acid and 8.9 gram percent of polyunsaturated fatty acid of omega-6 family. Omega-3 class polyunsaturated fatty acid is not present in the sunflower. In comparison to these plant sources, if you see the fatty acid composition of butter contains 7.2 gram of the saturated fatty acid and contains only 3.3 gram of monounsaturated fatty acid and little amount of polyunsaturated fatty acid. That is why in general we are saying that the fatty acids which are available to us from the plant sources, they contain less amount of the saturated fatty acids and they contain more amount of the monounsaturated fatty acid and polyunsaturated fatty acid of omega-3 and omega-6 family. Then, apart from the dietary fatty acid, cholesterol, it is also one of the important component of the dietary lipids. As far as the dietary sources of cholesterol is concerned, cholesterol is only available to us from the animal sources. Cholesterol is available to us from animal sources. Dietary cholesterol is not available to us from the plant sources. Plant sources does not contain cholesterol. Or if plant sources contain cholesterol, it is present in such a form that it cannot be absorbed from the gut. Therefore, dietary cholesterol is only available to us from animal sources. And the richest sources of the dietary cholesterol, if you see here, it is the brain, liver, means the organ meat, brain, liver, kidneys, they are the richest source of the cholesterol. Then the egg yolk is the richest source of cholesterol. Here is if you see brain 100 grams of the brain contains approximately 2000 milligrams of the cholesterol. If you see the cholesterol contents of liver, 100 gram of liver provides us approximately 300 milligrams of cholesterol per 100 gram. And whole egg contains approximately 300 milligrams of cholesterol. 100 grams of egg yolk contains 1500 milligrams of cholesterol. Beef contains 100 gram of beef contains 60 to 200 milligrams of cholesterol. Butter contains 250 milligrams of cholesterol. Milk contains approximately 10 milligram per 100 grams of the milk. So in this way, 100 grams of the milk contains approximately 10 milligrams of the cholesterol. So, but if you see the daily requirement of cholesterol, daily requirement of the cholesterol is approximately 1 gram. But it should be noted that cholesterol is also synthesized in our body. Approximately 700 milligrams of the cholesterol is formed each day in our body. The most important site for the formation of cholesterol in our body is liver. Approximately 50% of the cholesterol is synthesized in the liver. And other important sites for the formation of cholesterol is gut or intestine, skin, glandular tissues like adrenal cortex, testes, ovaries, and placenta. Therefore, it is advised that dietary cholesterol intake should not exceed 300 milligrams per day. Daily requirement is 1000 milligrams, 700 milligram cholesterol is synthesized, and we are advised to take only 300 milligram of cholesterol in the diet source. Cholesterol is very important component, but when this cholesterol is present in excess, normal blood cholesterol level is approximately 200 milligrams per deciliter. But if cholesterol level increases in the blood, then increased cholesterol increases the incidence of coronary artery disease. Cholesterol is very important. As you see, cholesterol is performing many important functions in our body. Cholesterol is very important precursor of vitamin D. Vitamin D is present in the skin in the form of 7-dehydrocholesterol. When it is exposed to ultraviolet light, sunlight, it is converted into cholecalciferol. This cholecalciferol, when it is transported to the liver, it is hydroxylated at carbon number 25 to form 25 hydroxycholecalciferol, which is then transported to the kidneys, and it is further hydroxylated at carbon number 1 to synthesize 1,25 dihydroxycholecalciferol, which is active vitamin D, which is very important for the absorption of calcium from the intestine. Then cholesterol, it is also substrate for the formation of steroid hormones like estrogen, progesterone, testosterone, glucocorticoids, mineralocorticoids. And beside all this, cholesterol is also important for the formation of all type of the cell membrane. So cholesterol is very important, but cholesterol is only hazardous for health when it is present in high concentration. And we have told you what is normal concentration of blood cholesterol. It is 200 milligram. Increased blood cholesterol level increases the risk of coronary artery disease. Then composition of dietary lipids. An average diet provides us about 100 grams, 60 to 100 grams of fat per day, out of which 90% of the dietary lipid is triglyceride. Dietary triglyceride is termed as saturated fat and unsaturated fat, depending upon whether the glycerol backbone is esterified with saturated fatty acids or unsaturated fatty acids. And other dietary lipids includes phospholipids, cholesterol, cholesterol esters, and free fatty acids. Current recommendations are maximum 30% of energy intake is fat, 10% each from saturated fatty acids, monounsaturated, and polyunsaturated fatty acids. And intake of cholesterol should be less than 300 milligrams. And in addition to this, the other factors which has the effect on the blood cholesterol level, it is the lifestyle, physical exercise, increase intake of dietary fiber, increase intake of dietary antioxidants are also important, vitamin C, vitamin E, beta carotenes. These recommendations are aimed primarily to influence cholesterol metabolism. Then Dietary supply of fatty acid also governs the composition of fatty acid in the body lipids. Metabolic processes in the tissues can modify the dietary fatty acids, or those that are synthesized in these tissues to produce various structures that are needed, because our body is equipped with enzymes which are called elongase, which can increase the size of the fatty acid. Like palmitic acid is 16 carbon containing fatty acid, it can be converted into 18 carbon containing fatty acid by the enzyme elongases. Or there are enzymes which are called as unsaturases. They can introduce double bond in the saturated fatty acid to form unsaturated fatty acid. But our body can not synthesize polyunsaturated fatty acid, parental fatty acid of omega 6 family, that is linoleic acid, and omega 3 family, linolenic acid. So, for this reason, with one exception, that is appropriate proportion of polyunsaturated fatty acid, actual composition of fatty acids supplied in the diet are relatively unimportant. Then coming to biological properties of the dietary fats. Biological properties of the dietary fats are determined by the chemical nature of the constituent fatty acid. That is, we have to see that this fatty, what type of fatty acids are present, whether this fatty acid, as we told you, plant fats, they contains more amount of unsaturated and polyunsaturated fatty acid, and the fatty acids which are available to us from animal sources, they contain more amount of the saturated fatty acid. So the chemical nature of the fat depend upon the constituent fatty acid, that is, whether it is containing saturated or monounsaturated or polyunsaturated fatty acid of omega 6 or omega 3 class. Then the presence or the absence of double bond classify saturated and then location of double bond is very important. With the location, we have already explained you that unsaturated fatty acids, they are they have three series: omega 9, omega 6, and omega 3. And then cis and trans configuration of unsaturated fatty acid. This cis and trans configuration, this is very important to consider. Naturally occurring fatty acids, they are cis configuration. Now, what is cis and trans configuration? It is the property of the unsaturated fatty acid. The fatty acids which contain double bond, they form two types of isomers, cis isomer and trans isomer. What are cis fatty acids? As you see here in this structure, in the cis configuration, both the hydrogens, they are present on the same side of the double bond. In the trans configuration, the hydrogen atoms, they are present on the either sides, on the opposite sides of the double bond. Are cis fatty acids, they have radical groups present on the same side of the double bond. Trans fatty acid, in trans fatty acids, the radical groups are present on the opposite side of the double bond. And naturally occurring unsaturated fatty acid in mammals are all cis configuration. Naturally fatty acids, which are present mostly in the plant sources, they are cis configuration. Even though trans fatty acids are not natural products, but they are also present in tissue in people who use Western culture diet or the bakery items. These trans fatty acids, they are formed by hydrogenation of fat. When hydrogen gas is passed at high temperature, this results in the formation of trans fatty acids. and trans fatty acids are used in the manufacture of certain products like margarine and butter, peanut butter. Trans fatty acid, they behave, this is a very important point, trans fatty acid, they behave more like saturated fatty acid in the body. Trans fatty acids, they elevate serum low density lipoprotein, which is bad cholesterol, and they do not elevate HDL, high density lipoprotein, which is good cholesterol, and they increase the trans fatty acid, they increase the risk of coronary heart disease. Trans fatty acids do not occur naturally in the plants, but they occur in small amounts, animal amounts. Small amount of trans fatty acids found in the ruminant fat. They are present in cow's fat, butter fat. Butter fat contains only 2.7% of the trans fatty acid. So where from trans fatty acid comes in the ruminant fat? They arise from the action of microorganisms. Even though trans fatty acids are not natural products, but they are present in people who use Western culture diet. They arise from the hydrogenation of fat. And this hydrogenation process used to manufacture food like margarine, peanut butter. Hydrogenation is used for what? For the solidification of these fats, which make them easier to handle. They are major components. Trans fatty acids are major component of commercially packed foods such as cookies, cakes, fast foods, and the fried foods. They actually increase the shelf life of fried foods. Trans fatty acid, we told you, they behave like saturated fatty acid. Trans fatty acid, when they are ingested by humans, trans fatty acids, they are oxidized, they are either oxidized or incorporated into structural lipids. And trans fatty acid, they increase low density lipoprotein, bad cholesterol, which increases the risk of coronary artery disease. And they decrease HDL. HDL is good cholesterol. HDL plays role in the reverse transport of cholesterol. Excess of cholesterol is transported from cell to the liver for excretion. Therefore, these trans fatty acids, they do not elevate HDL, good cholesterol, but they elevate a bad cholesterol. And these trans fatty acids, they also decrease the fluidity of membrane. They produce, trans fatty acids produce insulin resistance. They produce systemic inflammation, diabetes mellitus, and adiposity, and they increase the risk of coronary heart disease. Then coming to next point, the consumption of the type of fatty acid has influence on the blood cholesterol level. Consumption of type of fatty acid. Now we have told you trans fatty acid, we have told you about the saturated fatty acid, we have told you about the monounsaturated fatty acids, and we have told you about the polyunsaturated fatty acid of omega-6 and polyunsaturated fatty acid of omega-3 fatty acid. So all these fatty acids, they have influence on the blood cholesterol level. This is very important slide from the examination point of view. Trans fatty acids, when they are consumed, they increase low density lipoprotein, bad cholesterol, and they decrease the level of high density lipoprotein. They decrease HDL, and they increase the risk of coronary heart disease. That is why we told you trans fatty acids, though they are unsaturated fatty acid, but they behave like saturated fatty acids. Consumption of, you see here, saturated fatty acids, consumption of saturated fatty acid is also associated with increase in the plasma cholesterol level, increase in the plasma level of LDL cholesterol level, and increase LDL saturated fatty acid, they actually cause decreased receptor mediated uptake of cholesterol, thus they increase the risk of coronary disease. Saturated fatty acids, particularly myristic acid and palmitic acid. Myristic acid, it is 14 carbon containing saturated fatty acid. Palmitic acid is 16 carbon containing saturated. These two saturated fatty acids, lyric acid and myristic acid, they are most potent in causing the increase in the serum cholesterol level. Stearic acid, which is 18 carbon containing saturated fatty acid, is found in many foods. It's also present in chocolates, but the stearic acid has little effect on the blood cholesterol level. So in general, saturated fatty acids, they increase LDL level. They do not increase the HDL level, and they increase the incidence of coronary heart disease. Then intake of monounsaturated fatty acid. Monounsaturated fatty acids are very important, particularly talking about the oleic acid present in the olive oil. This monounsaturated fatty acids, you see, if these monounsaturated fatty acids, they are substituted for the saturated fatty acid, they lower plasma cholesterol. You see here, they lower plasma LDL cholesterol, and they maintain HDL cholesterol, or they increase, in some books it is written, they increase HDL level. And thus, these monounsaturated fatty acids, they decrease the incidence of coronary heart disease. So most important example of the monounsaturated fatty acid, which decrease LDL, which maintains or increase HDL level, is oleic acid present in the olive oil. Then coming to effect of polyunsaturated fatty acid of omega-6 family. The example of parental fatty acid of omega-6 fatty acid is linoleic acid. Omega-6 fatty acid, linoleic acid, it is obtained from the vegetable oils. And this linoleic acid, it lowers plasma cholesterol level when it is substituted for saturated fatty acid. You see here, omega-6 fatty acid, it lowers plasma LDL level. But omega-6 fatty acid, this also decreases HDL level. LDL level is bad cholesterol, and HDL is good cholesterol. Polyunsaturated fatty acids, they are decreasing the level of LDL, but they are also decreasing the level of HDL. So benefit of lowering of LDL is partial because they are also decreasing the HDL, which has cardioprotective effects. And these omega-6 fatty acids, they are present in vegetables, nuts, cottonseed oil, corn oil, and 5 to 10% of calories are recommended from omega-6 polyunsaturated fatty acid, because omega-6 polyunsaturated fatty acid can lead to autooxidation, and autooxidation causes production of free radicals, and production of free radicals increase the incidence of coronary heart disease. But in general, consumption of omega-6 fatty acid, they decrease the incidence of coronary heart disease. And this linoleic acid can be converted into arachidonic acid, which is 20 carbon containing polyunsaturated fatty acid of omega-6 family. And we already told you arachidonic acid is precursor of prostaglandins, leukotrienes, thromboxanes. Then coming to the effect of polyunsaturated fatty acid of omega-3 family. The parental fatty acid of omega-3 family is linolenic acid. Linolenic acid is 18 carbon containing fatty acid with 3 double bonds. We told you linolenic acid also gives rise to formation of eicosapentaenoic acid and docosahexaenoic acid. They also are omega-3 fatty acid. And these omega-3 fatty acids, they do not have any effect on the LDL or HDL. They do not decrease or increase LDL or HDL. But even then, they decrease the incidence of coronary heart disease. Because these omega-3 fatty acids, they suppress cardiac arrhythmias. They decrease serum triglyceride level. They decrease tendency of thrombosis. They decrease blood pressure, and thus they decrease the risk of coronary artery disease. So the mechanism, omega-3 fatty acid, they decrease the incidence of coronary heart disease, though they do not have any effect on LDL and HDL level, but they suppress cardiac arrhythmias and decrease serum triglyceride. They have decreased the tendency of thrombosis. They lower the blood pressure and they decrease the risk of cardiovascular disease mortality. And these linolenic omega-3 fatty acid, it is important source. It is the fish fat is rich in linolenic acid. So two fatty fish meal per week are recommended, and total calories about 0.6 to 1.2% is acceptable. So this is explained to you already. Consumption of type of fatty acid influence the cholesterol. Consumption of saturated fatty acid is associated with high level of plasma cholesterol level. They increase LDL cholesterol and increase risk of coronary heart disease. Monounsaturated fatty acids, when they are substituted for saturated fatty acid, they lower both total plasma cholesterol and LDL cholesterol, but increase or maintain HDL level. Therefore, monounsaturated fatty acid, they decrease incidence of coronary artery disease. Consumption of polyunsaturated fatty acid of omega-6 family, principally linoleic acid, which is present in the vegetable oils, lowers LDL, but it also decreases the HDL level, which protect against coronary heart disease. So omega-6 linoleic acid, it decreases the LDL cholesterol, but it also decreases the level of HDL cholesterol. In general, it protects against the coronary artery disease. But dietary polyunsaturated fatty acid of omega-3 family, that is linolenic acid, which is present mainly in the fish oil, though it has no effect on the LDL or it has no effect on the HDL cholesterol, but it decreases the incidence of coronary artery disease because omega-3 fatty acids, they suppress cardiac arrhythmias, they reduce serum triglyceride level, they decrease tendency of thrombosis, they lower blood pressure, thus they lower the risk of cardiovascular mortality. So this is summary. Saturated fatty acids, they are linked with heart disease. Saturated fatty acid increase risk of stroke and cancer. They increase LDL cholesterol. And saturated fatty acids, they decrease HDL cholesterol. Trans fatty acids, they have almost similar effect. Trans fatty acid increase insulin resistance, increase incidence of type 2 diabetes. They increase the risk of heart disease and cancer because they increase LDL cholesterol, bad cholesterol, and they decrease HDL, good cholesterol. So this is very important to remember. Usually, this is asked in the exams and in the OSP exams. And this point you should remember how omega-3 polyunsaturated fatty acid has how polyunsaturated fatty acids of omega-3 family has antithrombogenic effect. Polyunsaturated fatty acid of omega-3 family, we told you, they have no effect on the LDL cholesterol or HDL cholesterol. But omega-3 fatty acids, they increase the production of thromboxane A3, which is less thrombogenic than the thromboxane A2. Thus, this omega-3 fatty acids, they decrease platelet aggregation. Omega-3 fatty acids, they play a role in the synthesis of prostaglandin I3, PGI3, which is a strong anti-aggregating agent of platelet, which accounts for anti-thrombogenic property of the. So this is the mechanism how linolenic acid, omega-3 fatty acid, they have anti-thrombogenic effect. Then the polyunsaturated fats present in the diet, they are very important functions in the body. You see, fat, 1 gram of fat, it gives about 9.1 kilocalories. 9.1 kilocalories. 1 gram of glucose or protein gives only 4.1 kilocalories. Then the fat taken in the diet, they have high satiety value. They are important for the absorption of fat-soluble vitamins. Fat-soluble vitamin A, D, E, K, they are absorbed in presence of dietary fats. Similarly, fatty acids, they are also performing many other important functions, like particularly talking about the functions of polyunsaturated fatty acids. These are the important membrane component of phospholipids and important component of biological membranes. Polyunsaturated fatty acids, they have double bond in cis configuration. Therefore, this cis double bond, it bends at 30 degrees and forms sickle shape. Thus, it increases the fluidity of the membranes. So polyunsaturated fatty acids, they are present in cis configuration. We told you naturally occurring polyunsaturated fatty acid, they have cis configuration. So they are important component of membrane and they increase the fluidity of membrane. And these polyunsaturated fatty acids, they are also present in the mitochondrial membrane. And deficiency of polyunsaturated fatty acid causes swelling of mitochondrial membrane and decreases the efficiency of the electron transport chain, because mitochondrial membrane is equipped with the electron transport chain. So deficiency of polyunsaturated fatty acid in the mitochondrial membrane causes the swelling of mitochondrial membrane decreases the efficiency of electron transport chain, and uncouples the process of oxidation and phosphorylation. This explains the increased heat production in the deficiency of essential fatty acids. Then polyunsaturated fatty acids, they are important for the formation of cholesterol esters. Polyunsaturated fatty acids, they increase esterification of cholesterol to form cholesterol esters. And these cholesterol esters, then they are taken up by HDL, which are excreted. So polyunsaturated fatty acid, they increase esterification of cholesterol and increase excretion of cholesterol. Thus, they regulate blood cholesterol level. Then you see these polyunsaturated fatty acids, they are precursor of prostaglandins and leukotrienes. We told you arachidonic acid, which is 20 carbon containing polyunsaturated fatty acid. It is precursor of prostaglandins, leukotrienes, and thromboxanes. Polyunsaturated fatty acids, they have hypocholestemic effects and protect against the atherogenesis. Lipids of the gonads, they are rich in essential fatty acids, suggesting importance of polyunsaturated fatty acid in reproductive function. Then coming to DHA, this is docosahexaenoic acid. Docosa means 20 carbon containing polyunsaturated fatty acid with 6 double bonds. This fatty acid, it is obtained from fish fats. Fish fats actually, they feed on cold water plants and seaweeds. And this docosahexaenoic acid, it is also synthesized from linolenic acid, which is parental fatty acid of omega-3 fatty acid. They are present, this docosahexaenoic acid, it is present in high concentration in retina, cerebral cortex, it's present in testes and sperms. And docosahexaenoic acid, it is required for the development of brain and retina, and they are accumulated in the brain before birth and 12 weeks after birth, because they are required for the development of brain, retina, and development of vascular tissues. For this reason, this docosahexaenoic acid, it is also supplied via milk and via placenta. Deficiency of docosahexaenoic acid results in poor development of placenta, which may give rise to low birth weight babies. Patients with retinitis pigmentosa are reported to have low blood level of docosahexaenoic acid. Docosahexaenoic acid, it is also present in high concentration in retinal rod cells, where they give fluidity to the membrane and help in the rotational movement of rhodopsin within the membrane during photoactivation. So these all are the polyunsaturated fatty acids, also increase clotting time, increase fibrinolytic activity. So these all are the functions of the polyunsaturated fatty acids. Then coming deficiency of the essential fatty acids. Now, adults, on ordinary diet have no sign of essential fatty acid deficiency. However, those infants who are receiving formula diet, low in fat, are patients maintained on long periods exclusively on intravenous nutrition are low in essential fatty acid. They may show the deficiency symptoms of essential fatty acid. But these symptoms can be prevented by intake of essential fatty acid. Only 1 or 2% uh, calories are obtained from essential fatty acid. Deficiency symptoms of the essential fatty acids in humans includes skin lesions, scaly dermatitis, poor wound healing, papular eruption of hair follicles, and loss of hairs, alopecia, and thrombocytopenia. Rats, not in humans, rats who are fed on purified non-lipid diet, they exhibit reduced growth, ectopic pregnancies, infertility, abortion. These symptoms are seen in the rats who are deficient in polyunsaturated fatty acids. Consequences of excess fat intake. Excess intake of fat is associated with increased risk of colon cancer, breast cancer, prostate cancer, and in the animal studies, it is seen that polyunsaturated fatty acid of omega-6 series, that is linoleic acid, may be more tumorogenic because prostaglandins are derived from omega-6 arachidonic acid. Prostaglandins derived from omega-6 fatty acid, arachidonic acid, may stimulate tumor progression. And polyunsaturated fatty acid are not advised to be taken in excess. In normal ratio are very important, but when they are taken in excess, these polyunsaturated fatty acids, they are susceptible to auto-oxidation by free radicals. Free radicals have main physiological functions as well as pathological consequences. A strong oxidant property of free radicals are actually involved in the cytotoxicity, mutagenicity, damage to membrane, and free radicals they can also modify the enzymes. For these reasons, the proper ratio of saturated, monounsaturated, and polyunsaturated fatty acid of omega-3 and omega-6 family is very important. Then coming to biochemical basis for the management of hyperlipidemia. The aim is to reduce cholesterol and triglyceride lipids to normal lipids, to normal limits. Normal level of cholesterol, it should be managed to less than 200 milligrams. Our LDL level should be maintained less than 130 milligrams per deciliter. Our HDL level should be more than 40 milligrams per deciliter. And triglyceride level should be maintained below 140 milligram per deciliter. So this is very important that cholesterol level should be less than, this is normal, cholesterol level should be less than 200 milligram, LDL level should be less than 130 milligram per deciliter. HDL should be more than 40 milligrams per deciliter, and triglyceride should not exceed 140 milligrams per deciliter. Apart from this, so dietary management is very important to reduce. So, therefore, it is very important to reduce caloric intake, which should be coupled with exercise to achieve ideal body weight. We have to reduce total fat intake to provide only about 30% of total calories from fat. We have to reduce the amount of saturated fatty acid. And we should take proper ratio of monounsaturated and polyunsaturated fatty acid. In essence, it is recommended that consumption of red meat, dairy products, fried food should be reduced, while intake of dietary fiber, fruits, vegetable, pulses may be increased. Fiber increases intestinal motility and reduces the reabsorption of bile salts, increases the excretion of bile salt, leads to increased conversion of cholesterol to bile acids and upregulation of hepatic LDL receptors, resulting in the reduction of plasma LDL level. Then atherosclerosis is an important cause of subsequent morbidity and mortality. The medical problem in the atherosclerosis is due to formation of atherosclerotic plaques, and this leads to coronary artery disease like angina, myocardial infarction, sudden cardiac arrest. Atherosclerosis can lead to cerebrovascular disease, causes hypertension, stroke, and transient ischemic attacks, and can lead to peripheral vascular disease. Then blockage of coronary arteries by atheroma, obstruction, blockage in the coronary causes blockage of the coronary arteries causes obstruction to blood flow due to accumulation of cells, mostly macrophages, and the accumulation of lipids, mainly cholesterol, and accumulation of variable amount of fibrous connective tissues. All accumulation of cells, lipids, and fibrous tissues cause blockage of coronary artery disease. So what is mechanism of formation of atheroma? First, there is injury to endothelium, and then there is invasion of monocytes in the intima. Monocytes then engulf the lipids, and they are transformed into foam cells like macrophages. Then there is migration of smooth muscle cells from media to intima, and there is formation of fibrous fatty cap. Fibrous fatty cap may remain intact, or this fibrous fatty plaque may become active due to further injury and stress, and this leads to ulceration, platelet aggregation, and thrombosis, which may lead to occlusion of blood flow. This is mechanism of the formation of atheroma. So here some of the risk factors for the heart disease includes smoking, high blood pressure, high cholesterol, diabetes mellitus, and obesity. All these are the risk for coronary artery disease. Additional risk factors includes lack of exercise and intake of unhealthy diet, bakery foods, and stress. All these are the risk factors. And the process of coronary heart disease is worsened if there is insufficient high density lipoprotein. High density lipoprotein, it is considered as good cholesterol, because high density lipoproteins, they play a role in the reverse transport of cholesterol. Excesses of the cholesterol is removed from the cell to the liver for excretion. So increased HDL level is cardioprotective. Therefore, increased HDL is considered as good cholesterol. But increased LDL, increased low density lipoprotein, increases the incidence of coronary artery disease. Low density lipoprotein, physiologically, they transport cholesterol from blood to the cell by combining with LDL receptors, which are present on the liver and on extrahepatic tissues. But when there is defect in the LDL receptors, which are called ApoB100 receptors, LDL cannot bind to their receptors. Therefore, it is not transferred in the cell, and there is increased LDL in the blood. And increased LDL results in the accumulation of cholesterol in the arteries, causes narrowing of the arteries, causes roughness of the arteries, and increases the incidence of blood pressure and increases the incidence of coronary artery disease. Therefore, LDL cholesterol is considered bad cholesterol and HDL cholesterol is considered good cholesterol. Then heart disease is highly preventable and can be reversible. Healthy diet is major factor in controlling so taking of vegetables, cellulose-rich diet is good in, and taking proper proportion of saturated, monounsaturated, and polyunsaturated fatty acid of omega-3 and omega-6 unit. Proper ratio is very important. Now here we are considering the factors which decrease risk of coronary heart disease. This includes low-fat diet having 25 to 30% of caloric supply, low intake of saturated fatty acids, intake of fats that contain balanced proportion of monounsaturated and polyunsaturated fatty acid, moderate intake of dietary cholesterol. Dietary cholesterol should not exceed 300 milligram per day. Approximately 700 milligram cholesterol is synthesized. Therefore, only dietary intake should be less than 300 milligrams. And intake of fiber diet. Increased intake of antioxidants is very important. Vitamin C, vitamin E, selenium. These antioxidants, they protect from oxidation of LDL. Oxidized LDL is actually main cause for the formation of foam cells. And then change in the lifestyle, that is adequate exercise, is very important to decrease the risk of coronary heart diseases. And these are some of the factors which increase the blood cholesterol. In this context, hypothyroidism, obstructive jaundice, diabetes mellitus, and nephrotic syndrome, they are important cause for increasing the blood cholesterol. Hypothyroidism, it decreases the synthesis of enzyme 7-hydroxylase. 7-hydroxylase actually converts cholesterol into bile acids. So if cholesterol is not converted into bile acids, there is decreased excretion of cholesterol. Obstructive jaundice. In the obstructive jaundice, there is impaired excretion of cholesterol through bile, leads to accumulation of plasma cholesterol. Diabetes mellitus also increases the availability of acetyl-CoA, which is precursor for the cholesterol synthesis. And in nephrotic syndrome, there is urinary loss of albumin, which leads to compensatory increase in the synthesis of globulins. Thus, lipoproteins are increased. There is corresponding elevation of cholesterol. Diet rich in saturated fat also increases incidence of blood cholesterol. Smoking nicotine causes vasoconstriction of coronary and carotid artery and enhance lipolysis and increases very low density lipoproteins. Stress, excessive consumption of sucrose, excess intake of calories, and lack of exercise increases blood cholesterol level. Then family history of coronary artery disease. Homocystinuria causes altered endothelial cell function leading to thrombosis, which is risk factors for coronary artery disease. Then factors would decrease blood cholesterol level. It is thyrotoxicosis, malabsorption, acute infection. Niacin in large doses inhibits adipose tissue lipolysis and lowers blood cholesterol level. Increased intake of dietary fiber and estrogen lowers blood cholesterol level. Estrogen increases the synthesis of high density lipoprotein, which play important role in the reverse transport of cholesterol to the liver for excretion. Then coming to metabolic syndrome. The hallmarks of metabolic syndrome are abdominal obesity, insulin resistance, and decreased glucose tolerance. Body cannot properly use insulin even in presence of normal insulin. Therefore, metabolic syndrome is also called as insulin resistance syndrome. People with metabolic syndrome are at increased risk of coronary heart disease. What are the criteria for diagnosis of metabolic syndrome? First criteria is elevated waist circumferences. That is, the waist circumferences more than 90 centimeters in men, and for women it is more than 80 centimeters. Then increased level of triglyceride more than 150 milligrams per deciliter. Normal is 140 or 130 milligrams per deciliter. Decreased level of HDL, good cholesterol. That is, if cholesterol level is decreased more than 40 milligrams in the man, and in the woman it is less than 50 milligrams. This is criteria for the diagnosis of metabolic syndrome. Elevated blood pressure, elevated fasting glucose, insulin resistance. All these are parameters for the diagnosis of metabolic syndrome. Additional parameters includes coagulation abnormalities, hyperuricemia, microalbuminuria, and non-alcoholic steatohepatitis. Diagnosis is made if any two of above factors are present. This is all about the dietary lipids, but we stop it here.